Hi, welcome to Proven Cures. My name is Sarah McLeod, your host for the channel, and today is Wednesday, October 23rd, 2024. This video is actually dedicated to some exciting news in medical device development that I want to share. It's new to me. It's news to me. It may not be news to you, especially if you're the parent of an asthmatic. But it may be news to you. It may be news to your treating physician, your treating pediatrician. And after hearing this video, you may want to actually talk to your child's pediatrician about this new development in monitoring your child's asthma. So let's have a look. Um, so electronic monitoring devices in medical treatments right now are all the rage. You may have seen lots of recent ads about CGMs, also called continuous glucose monitoring machines that are now being used not just by diabetics, but by just average individuals who want to be able to track their glucose rates to prevent the development of disease. Well, now electronic monitoring devices are available to monitor medication adherence in asthma patients. And the study that I'm about to share actually reveals that the use of these electronic monitoring devices result in a significant decrease in the odds of uncontrolled asthma. Let's have a look, see. I'm scrolling up on a page with my mouse, just bear with me. The title of the study is The Efficacy of a Novel Monitoring Device on Asthma Control in Children with Asthma. It was published September of 2021 in the Annals of Allergy, Asthma, and Immunology, which is the official publication of the American College of Allergy, Asthma, and Immunology. Okay, so it opens with a brief explanation about why the study was conducted. Asthma is the most common chronic pediatric disease affecting 6.1 million children in the United States, with poor medication adherence being a major cause of asthma exacerbations and treatment failure. Average adherence rates in pediatric asthma are reported to be 30 to 40% without much improvement in 3 decades. That is not too surprising to me because I remember being a sole data collector for a pediatric study in HIV and HIV medication um, many years ago, many moons ago. And the primary issue with that patient population was medication adherence. Children don't necessarily take their health very seriously. They do not want to focus on having to constantly incorporate medication into their daily lifestyles. They want to rip and run, especially like if they're required to use an inhaler. They probably don't even want to think about that inhaler. They just want to run off with their friends. They tend to lose things that are vital to their lifestyles, vital to staying alive and out of the emergency department. So I completely understand about adherence rates in pediatric populations and why it is definitely an issue in maintaining the treatment progress in preventing asthma attacks. So it says inhaled corticosteroids reportedly are the most effective treatment and are the mainstay of therapy in persistent asthma. High medication compliance reduces the risk of asthma exacerbation. Thus, there is a need for interventions to improve asthma control. All right, so innovative technologies are increasingly being used, and the aim of this pilot study was, in fact, to assess the effectiveness of a novel electronic tracking system for the management of pediatric asthma. Children between the ages of 6 and 17 years old with a diagnosis of persistent asthma requiring regular treatment with an inhaled corticosteroid were enrolled in a 12-week study. Participants with other disorders impacting breathing or developmental delays were excluded. The monitoring device, was designed and developed by Gecko Health Innovations and marketed as CareTRx. And I'm going to write that down and put that and highlight it here on the video in case you want to discuss it with your child's pediatrician. The sensor fits on top of the inhalers and records every actuation of the inhaled corticosteroid medication. An application paired with the sensor provides reminders for daily medications and provides also a complete journal of asthma for participants. Medication usage data from the sensor is encrypted, uploaded to the participants' accounts, and transmitted to a secure HIPAA compliant environment in the cloud database. Participants had with baseline being measurements taken before use of the monitor, um, and final visits during which they completed the standardized asthma control test. I'll call it the ACT asthma control test, and an adherence questionnaire. They were followed up by phone at weeks 4 and 8 and completed the asthma control test. So, the efficacy of the tracking system in asthma control was a primary goal of the study, and it was measured by a reduction in percentage of participants with uncontrolled asthma at baseline versus follow-ups. Uncontrolled asthma was defined as having an ACT score of equal or less than 19. Secondary outcomes were changes in non-adherence scores and adherence rates measured by the tracking system. Lower scores denoted better adherence. Adherence rates being defined as the proportion of controller doses taken as recorded by the device relative to the number of prescribed doses. So 26 participants with a mean age of 9 years of age were enrolled, out of which 62% were male. The percentage of participants with uncontrolled asthma dropped from 48% at baseline to 22% at the final visit. This improvement was observed at 4 weeks, with rates down to 26% and further reduced to 22% at 8 weeks, and it remained improved until the final visit. Overall, the intervention was associated with an whopping 80% decrease in the odds of having uncontrolled asthma at study end. And you know what else, guys, I was thinking, although it's not mentioned here? These monitoring devices are gadgets. And children in this era are surrounded by gadgets. Wealth and status are also defined socially by having these gadgets, and they're part of a learning curve, and also signify something that's fun to use, just like the introduction of electronic toothbrushes for children, right? So now they make this fun sound. They come in all these fun colors in different shapes and this and that, and they actually add an element of just levity to a serious situation, which is dental care. But children don't have to look at it that way. They can look at it as their fun time with their machine, their pretty machine or whatever, however, children look at things. So, just a very fun, lighthearted way. And so having this monitoring device on your inhaler turns it from, a burdensome medication task to something more like, oh, look, I can, it's something computerized and I can track it on my phone and so on and so on. So it kind of just changes the dynamic of taking your medication. So that in and of itself might be a good reason to discuss it with your child's pediatrician if it's not something you haven't already heard of or are doing. So I hope you find this helpful. Please like, share, and subscribe. By all means, leave comments. Let me know what you think. And thanks for watching. I believe my next video is going to be on a clinical study, a more recent clinical study about controlling high blood pressure in a natural way. All right. So please, yeah, like, share, subscribe, and comment. Thanks. Until next time. Bye bye.